It's a minimally invasive procedure. So the name is transcatheter aortic valve replacement, so TAVR. And a transcatheter element means that the valve that's going in is at the end of a catheter, a big long catheter, and can be blown up with a balloon. Just the way a catheter would do stents, for example, in an artery, coronary artery. So they go in the arterial system, so in the groin area, there's a very large femoral artery, which then leads into ever larger arteries in the aorta, right? So that's the way they go into the heart.
John Ruffolo was a relatively healthy person before his procedure. Within 2 days, he was discharged from the hospital. After cardiac rehab and follow-up visits with his doctor, the symptom of shortness of breath was relieved.
After the procedure, everything is really great. What brings it on, the symptoms for this, is shortness of breath. And when the shortness of breath gets to be debilitating, that's when you say, what can I do about this? And that was my case. Just walking the dog or climbing up a flight of stairs, I'd get short of breath. And I'm a fairly active individual, and so that really cramps your lifestyle. Say, well, gee, why do I have to get so short of breath? And it really slows you down. You say at a certain point, you say, well, I'm going to stop, what I'm doing, and won't take long walks and stuff like that.
John continues his upper body activities, such as shooting at the gun range and archery. He says that physical activities are valuable to ensure successful recovery after any type of procedure, regardless of your age.
The valve replacement by this technique is, I think, everyone would recommend, simply because, well, I'm sure there could be certain circumstances, details, that would say, well, no, you have to have the open heart surgery. Surgeons would decide that. And that's part of the evaluation. But I think the idea that the valve isn't going to last long enough, hopefully that one will prove out to be okay, that it'd do pretty much as well as what you would do with open heart surgery. And in that case, that being the only distinction, I would say definitely the TAVR. To me, in my particular case, very successful. I'm pretty sure the data generally show, clinical data show, that for the large majority of patients, it's very, very successful.